I would say that the government which is bringing up this SHA scheme, it's a good idea because it will help cover more people and will bring equitable healthcare to everybody. But I will also ask the government to ensure that all the poor people are also covered and they are helped in somehow, so that they can also get quality healthcare in all hospitals. And I will also ask the public to support the government by enrolling as much as possible for this scheme, so that they can avail the healthcare facilities as the government envisions it for them. The 60th Independence Day of Kenya, the Jamhuri Day, is being celebrated. Lifecare envisions that we have to be present in almost all the tier 2 and tier 3 cities also of Kenya in the next few years. We are coming up with many of our facilities in other areas like Mololongo, Mikendu, and Migori was the second hospital which was set up under the Lifecare brand. And in the last 3 years, we have endeavored to give the best healthcare that is possible in the Migori County. After the MCRH. We are the only hospital right now with a CT scan available, with all the facilities available, in-house gynecologist, in-house surgeon, and in-house pediatrician. And we are the only hospital providing critical care services through ICU and HDU. What we intend to do in the next couple of years is to bring all the facilities under one roof, like orthopedic surgeon, a neurosurgeon, ophthalmology unit, where eye surgeries can be done for the patients. And I think the government is already supporting a lot in the healthcare facility by bringing in NHIF and by covering all the public. But more needs to be done to make it all comprehensive, so that every last person of Kenya, every last person of the public can be covered by healthcare facilities, and they can get equitable healthcare quality services at all units.
Okay, so one of the major challenges that has been facing the healthcare industry is the scope of services and also affordability. So, of course, through the government, uptake of NHIF has been low, especially in the rural area. Now, the government has created another social health authority. So I think it's a good idea because it will enable many people to access services. So we've been dealing with a lot of challenges with affordability. So I think now the new authority will enable more people to afford the services. Now from our side, we will encourage people to uptake this the way we have been doing with NHIF. As a facility, we were empaneled with NHIF. Now with the new scheme, we'll also make sure that we are on board, and we'll also encourage people to take up this new scheme so that they are able to access these services. As a facility, we have also invested a lot in bringing more specialists to the town, so that people can even access a wide variety of services from our place.
The initiative that the government is coming up with, that is the SHIF, it's a good idea because it's going to make all Kenyans have equal opportunity to enjoy quality health services across the whole 47 counties. I think in regards to the SHIF, it's a good initiative that the government has come up with, and this because it's going to make all Kenyans in all the 47 counties get equal opportunity to enjoy quality health care across. And I will also urge each and everyone that they need to come up and register for the same and support the government for this particular initiative. And most importantly, I think as the SHIF is going to be empaneled, it will also be, the government can make it in such a way that each and every Kenyan can enjoy these quality healthcare services in every hospital without segregating them, maybe just to some particular public hospital or health center. It will be better that at least. So I think it's a good initiative. So it will enable each and everyone to enjoy good quality healthcare across. But most importantly, the government should make it in such a way that anyone who is sick, you can go to any hospital in Kenya, be seen, do all the diagnostics, get all your medicines and lab works, everything that you need without being told maybe to top up or something like that.
Now, on the current medical scheme that has just come in, we fully embrace it, but we'll suggest that the government consider the special populations, like the employed generally enjoy it, but the unemployed and the self-employed should be encouraged to increase on their uptake on it, and then the special categories within the population. Currently in Migori, we have a lot of people who are not enrolled in NHIF because of affordability of the scheme. But we will encourage the government to consider this special category so that each and everyone should enjoy good health care. Currently, we enroll a lot of people on NHF, and we still encourage people to embrace even this new scheme, working together with the community health promoters, religious leaders. We'll try to do our best to target each and everyone within the community so that we can bring them on board under these schemes, so that affordability, accessibility, and quality health care can be achieved, especially now that we are transitioning to the universal health coverage. It is something we really appreciate. Thank you. Categories will encourage the government to at least do a subsidy to them or pay on their behalf, like the street kids, because a disease outbreak within a community will affect each and everyone. So if we have just a top tier affording the healthcare, then the people who cannot afford it left outside, it will still be a problem within the community. So we'll encourage the government to do a subsidy or to pay on behalf of the special populations within the community.
So as Kenya celebrates its 60th Jamuhuri Day, we at Lifecare Hospital Migori team, we are here as healthcare partners with the county government at the Jamuhuri Day celebrations. We at Lifecare are giving the best of healthcare that can be provided to the Migori County. Our vision is that we can provide healthcare to everybody in the public, to the civil servants, to the public, and to every corporate or any kind of person who needs good healthcare in an environment which is clean, which is friendly, and with the best of clinicians and nursing staff. Also, we are NHIF registered. We are NHIF comprehensive hospital, so the entire public is eligible to get treatment free of cost in the OPD also if they register with us. Today at the Jamuhuri Day celebrations, we are here as healthcare partners with the county government, and me and my team, we are ensuring that we have a NHIF registration camp and a health camp for the general public where free sugar testing, free blood sugar testing and free blood pressure is being given, along with medical and dental advice to all the patients who are visiting us. Also, we are doing NHIF registrations for the patients so that they can get the cashless services under the government scheme as far as possible.
In my personal view, right now Kenya is marking the 60 years since independence. As I even said earlier, even I as an administrator, I'm an assistant chief. My wife is sick, and I'd even asked permission, and I'm here at Lifecare Hospital. So what I'm now recommending is that Lifecare is doing a good work in Migori County, in Kenya as a whole, and I would actually request the government of Kenya, if in any case there is any support that they can actually give Lifecare Hospital, kindly His Excellency His Excellency Dr. William Samoei Ruto do something to Lifecare Hospital in order to uplift them to a higher standard to exceed where they are right now.
The Migori North SDA. Baada Migori North SDA
At the Jamuhuri Day, we are supporting the community. We are giving some health services for free. and tests are being done here for free. So we really appreciate what the extent that the country has gone through, and we would like to advise everybody who may like to visit the hospital to reach and get the treatment there. They are of a high quality. We have trained doctors, international doctors, and the international nurses. Start since we are marking the 60th independence of the country. I think healthcare hospital have advanced the level of treatment by bringing in the modern facilities to be used in treatment. For like CT scan, we have all the equipments that are required for modern diagnosis, and all the tests that can be carried out. So you don't have to travel that long to far hospitals. Now we have them at the ground everywhere. It is accessible to everyone within the vicinity.
Hizo